I've always believed in being involved. And when I was in veterinary school, there were actually a couple of professors who were very strong believers in organized veterinary medicine. And they encouraged us to go to the annual conference and encouraged us to get involved in committees and what have you. And so I did that as a student. And so that was my first contact with TVMA and organized veterinary medicine. And I loved it. And just, I mean, not only the work that the organization was doing, but you're around people who are engaged in the profession. And I think when you're actually engaged in the profession, it's not just a job, but something you're really enjoying. You feed off that energy, right? And you can share that joy, and you can commiserate over bad days and challenges, but also people who truly appreciate all the good things that you get to do. And then you find ways to grow and help give back and to contribute to the profession, to continue to make it better.
Hello, and welcome to the Evolve Vets podcast. I'm your host, Dr. Bethany Weinheimer. Hello, and welcome to the Evolve Vets podcast. I'm your host, Dr. Bethany Weinheimer, and today we are here with Dr. Lori Teller. And Lori, we have had so many fun experiences together. I've known you since I was a student in vet school, and I was starting to kind of dip my toe into this organized veterinary medicine place. And I remember being a student, and you and your husband were hanging out at like a cocktail bar between lectures. And I just remember you coming up to me and just having this beautiful conversation about what my experience was like in vet school. And you just made me feel very seen.
Oh,
and it's like really helped me stay connected to this advocacy lane.
Great.
And I just want to say thank you for that. I look up to you as a leader, and I think you're one of these women that can have the difficult conversations, can be on this journey of like, yes, we're going to do this. We're going to do it together. And I just admire that so much. And so I really am excited to have you here on the podcast.
I'm excited to be here.
Yay, this is going to be so great.
Yeah.
So excited to share this conversation with you. We have listeners all over the world: Australia, New Zealand, India,
Fun.
Mexico, Canada, and America
talking
too.
Spanish.
So yeah, no, I'm so sorry. Like, I am also not bilingual. I'd really love
I've done
that.
Duolingo, but I can't do the conversation.
I know my boyfriend's from Brazil.
Okay.
And so I'm trying to learn Portuguese, and I'm like, this is so hard.
It's hard.
So much respect for people that can speak
Good or
multiple
bilingual.
languages. Yes.
I'm so jealous.
So jealous.
Yeah.
Absolutely. So all of our listeners are going to be so interested to hear about your journey. So can you just walk us through your path and where you've ended up today?
Yes, because it's been a path.
It's been a path.
I am one of those stereotypical, I was 5, I'm going to be a veterinarian.
Me too.
Yes. I mean, this is it. The whole time, never wavered. When I turned 12, my father said, well, you know, being a veterinarian really isn't just playing with puppies and kittens, doing all of that.
Yeah.
It's like, they get sick, and you should probably really find out what veterinarians do.
Dads give the best advice.
Dads are awesome. So he said, you really need to know what a veterinarian does, and you should go talk to our family veterinarian and see what they do. And so my mom drove me down there. I was 12, and I said, can I come hang out with you? It was summertime, and see what it's like to be a veterinarian, because this is what I want to do. And he's like, sure. So obviously in the days before insurance and was like a big deal, he's like, yeah, come hang out.
Where did you grow up?
In Houston.
In Houston. Okay.
Yeah. So this was at Meyerland Animal Clinic. And I passed out on my first day. He's like, are you sure you want to come back? I'm like, oh, no, really. I love it. It was just hot. It was overwhelming. I want to come back.
That's so cute.
I did that every day for the rest of that summer. Did it every summer until I turned 16 and could get a paying job there. And so then I started working there after school and over all the breaks. And then when I graduated, I went back there to be a veterinarian, and it was awesome. Loved it.
That's so great.
So yes, my dad gave me great advice, and yes, I was right. I wanted to be a veterinarian when I grew up, and I practiced there for 28 years, and then was asked to join the faculty at Texas A&M. So I became a clinician at A&M, and really cherish that as well. I mean, you're right there on the cutting edge, right? So all the new things you hear about, so many people to bounce ideas off of, getting to interact with the students. Definitely the highlight of being on faculty at A&M is being clinical and getting to teach students, and just the energy and enthusiasm being around students. Amazing. And then just today, it was announced that I will be the next executive director of the Texas Veterinary Medical Association.
So excited.
So,
Congratulations.
Thank you.
Executive director.
Yeah. So just the next step in my journey in veterinary medicine. And I hope to build on all the previous skills and knowledge and what have you that I've built over this time to further serve the veterinary community.
I love that so much. So for those of our listeners that don't know what an executive director does, can you tell us a little more?
Sure. So the executive director is like the CEO of a veterinary medical association. And Texas has the second largest state VMA in the United States.
Whoop, whoop.
So we have several thousand members, veterinarians, credentialed veterinary technicians. We also have practice managers, provide continuing education, do advocacy work, lots of member benefits, and just the way to be the voice of the profession in the state of Texas.
Oh, that's so exciting and so well deserved. You've represented Texas like very well, and Houston. I'm from El Campo, Texas, so Houston's the biggest city that was close to me growing up, and it's just such an honor. So tell me a little bit, and you've also been AVMA president too.
I have.
Right? So how did that kind of fall in there?
So I've always believed in being involved. Like even when I was a student, I was involved in whatever organization was important to me in school. And when I was in veterinary school, there were actually a couple of professors who were very strong believers in organized veterinary medicine, particularly the TVMA. And they encouraged us to go to the annual conference and encouraged us to get involved in committees and what have you. And so I did that as a student. And so that was my first contact with TVMA and organized veterinary medicine. And I loved it. And just, I mean, not only the work that the organization was doing, but you're around people who are engaged in the profession and truly involved. And I think when you're actually engaged in the profession, it's not just a job, but something you're really enjoying. You feed off that energy, right? And you can share that joy, and you can commiserate over bad days and challenges, but also people who truly appreciate all the good things that you get to do. And then you find ways to grow and help give back and to contribute to the profession, to continue to make it better. And so I got also involved once I graduated and went back to Houston, got involved in our local VMA, so the Harris County VMA, and worked through that, served as president there. And when I finished my time there, I was asked to join the board of directors for the Texas Veterinary Medical Association. And so I did that, really had some great mentors on the TVMA board. And they were like, you really need to run for executive committee and do those things. I was like, okay, if you believe in me and you think I can handle it, then I'll give it a go. And so I did that, became president of TVMA. And by that point, I was just hooked. I mean, organized veterinary medicine is really tremendous. And it's brought me so many opportunities. So I feel like whatever it's offered me and brought to me and the people I've met and the things I've gotten to do, I hope that I can then spread that and let other people share in that and learn from that. And so represented Texas in the AVMA House of Delegates, and then joined the AVMA Board of Directors, and was eventually elected to be president.
Look at you
And
go.
so, yeah.
What an exciting journey.
And just amazing people throughout the whole journey.
Wow. Like, it's so cool to hear the different ways you've interacted with veterinary medicine, because it's one of the most beautiful things about our profession, right?
Yeah.
There's so much diversity in what you can do as a vet.
Yes.
And I just think that it's so cool hearing about your specific journey through that and where it's led for you, which is so
been
fun.
great. So now I get to have a different role in organized veterinary medicine. And I got to teach students, and I got to do clinical practice, and I still go back on random Saturdays and do relief at Marlene Animal Clinic. So I still get to see clients and patients and put my hands on dogs and cats. And it's not always about playing with puppies and kitties, but sometimes we do get to play with
sometimes we do, and these are the best days.
They are.
I love how diverse that is, and that you're still able to keep your hands on the thing that you like we're so committed to when you're young.
Yeah.
And going back on Saturdays to connect with those clients, connect with the pets is so good.
It is.
I'm excited about hearing from your transition from a practicing veterinarian into this like academia seat. Like, tell us a little bit more about that and what's been the biggest change for you there?
Nobody can appreciate what you do in academia till you're actually in academia. Like, I certainly had plenty of colleagues and friends that were clinicians and professors at A&M. And it's kind of, what do you do all day? Well, I teach, and you go to some meetings and you interact with the students. And if you're a clinician, you're on the clinic floor. And even when I interviewed, I was like, how do you spend your time? Because you're not on clinic every week. I mean, you're on clinics a lot of weeks. But then if you're doing a random lecture here or there, then what? And like, oh my God. I mean, after 2 weeks, I was like, I get why nobody has any time. So a lot of time on the clinical floor, but also preparing for your lectures. I mean, you don't just sit down and a PowerPoint doesn't just pour out of you, right?
Right.
I mean,
that's some intentional like thought processing.
There are several hours that go into creating a lecture, and it's not just throwing words on the slide, because you want people to engage with it and learn from it and remember it. And then even if you've been doing it for a few years, you have to update it. So it's not like, okay,
plug and play
that, and I can keep using that same presentation for the next 5 years. No, you gotta update those things. And so there's that. Then you get involved in student clubs. Like, I'm a faculty advisor for the Women's Veterinary Leadership Development Initiative club at A&M. You get involved on committees. So I'm on the promotion and tenure committee. I've served on search committees, and right now I'm on the entrepreneurial enterprise advancement committee, which is a university level committee. So there are various things that you have to do for that. I oversee our telemedicine program. So building that, what does that look like? Helping teach people how to use telemedicine.
Yeah, tell us more about that, because that was one of the initiatives that you worked on with the AVMA too, right?
I also did that with the AVMA. So telemedicine, just like so many other things in practice, we want to incorporate new technology to be able to help serve our clients and patients. And I think what a lot of people have to remember is that it's not like this own separate part of veterinary medicine. It's a tool that we can all use. So if I see a dog with a skin infection and maybe they have to travel a long distance or something to come see me, especially if it's at A&M, then maybe our follow-up visit can be done like this on a camera, audio, video, and they can send me pictures. I can see the dog and we can talk about how it's responding to the treatment. If I need to tweak it, I can tweak it. If it's working, we can finish it out. Behavior cases are great for telemedicine. Once, especially, I've rolled out any physical problems, then we can use telemedicine to continue that behavior management. I can think of a very large cat patient I had. I'm talking like 17, 18 pounds.
Wow.
That was super aggressive towards this tiny chihuahua that the owner brought into the house. And the cat, I mean, literally could sit on the dog and squash it.
Wow.
Not obviously great interaction.
Yeah.
So we went through the whole behavioral process, used medications where we needed to. And I will not say that the cat and dog ever loved each other, but they tolerated each other. And so that was enough.
And that was a big win.
Yes.
Yeah, we'll consider the toleration
exactly. The owner could leave and not worry that there was going to be blood and fur around her place when she got home.
That's amazing.
So telemedicine, our specialists use it, consults with other veterinarians, follow-ups with their own patients. Some of the specialists, if a client's going to be coming from a really long distance, will do a pre-visit to make sure they can even provide the help that the client will need before they may have to make a 6, 7, 8-hour drive.
Wow.
College station. So that's another way that we can use telemedicine to help our clients and patients potentially save the client money. So even if it is an appropriate visit, they can come in, but we may have saved them a night of hotel because they've already done all that pre-stuff.
Right. The history, the check-in.
All of that. So they just need to see them and do their physical and whatever other diagnostics mean. But, that could save a client a couple $100.
That's so true.
Yeah.
So have you seen people being resistant to it, or what's the biggest gap between starting maybe doing telemedicine versus I'm sure there's like some fears there.
Oh, sure. I mean, and so there are some people that are resistant. Some of it's just time. Like, how do I work this into my day? And that can be overcome.
Yes.
There are ways to work it into your day. You can use your staff to help you. Your technicians, your assistants can also help you, especially with some of their pre-stuff. I mean, technicians can help take histories and do those things for you. And let's say I have diagnosed an animal with diabetes. Okay.
Yeah.
So I've diagnosed it. Obviously, I've done my physical. I've gotten my blood work. This is diabetes. And I've taught them how to give the insulin, or my technician has taught them how to give the insulin. And then, of course, the first thing they do is get home and they're like, I have to get my cat a shot, right? Or my dog, whoever.
Yeah.
They can have a telemedicine visit with my technician who can walk them through. Remember, this is how you drop the insulin. Let's double check that you're at the right level. And
wow, that probably brings so much comfort to the clients in that moment.
Definitely.
And then what a great way to superstar our techs,
Yeah.
that getting them to shine and have that, hey, I'm here with you. You're not alone. Let me teach you how to do this again.
Yes.
You're not let's do it together.
Well, I mean, all of those things, and they can, if a client's having a hard time with a diet plan, right? We've given them the diet plan. We've told them we want to do a check-in on it. I can do it as the doctor. I can have a student do it. I can have a technician do it. What are your struggles with this? Why, how can we help you overcome some of those barriers so that we can help you and Fluffy be successful losing 10, 15, 20 pounds.
Oh, that's amazing. It's cool that you've been able to bring something that you started earlier on into A&M's world and how we serve the clients of the specialty hospital too. Do you see our students getting more excited about those type of technologies?
I do. Actually, I had a meeting a couple of months ago with somebody from the class of 2025.
Wow, that's
I have
crazy
to start doing that. I know. So somebody who just graduated in May, who spent his first few months, of course, getting comfortable just in practice. And now that he's gotten comfortable in practice, he really wants to start a telemedicine service in the practice. And so we talked about what that looked like, what he needed to do to get prepared, get his team on board, things that he needed to know for sure, other things to think about.
What are the steps?
So
for anybody who,
may
a
want to
practice
do,
and is like, I want to learn more.
So first, remember, it's a team effort, right? You're not going to be scheduling your appointment. You're probably not going to be making sure your client's equipment works, but you can have a staff member do all of that. Or depending on how you're set up, you may be able to schedule a telemedicine appointment. The client may be able to online, right? And into the doctor's schedule. But what does that look like? How are you going to schedule these? How much time are you giving yourself for a telemedicine appointment? And in general, telemedicine appointments, unless you're doing a behavior consult or something like that, but a recheck, are usually less than 10 minutes.
Yeah, I was going to guess 15, but 10's even better.
So, for rechecks, a lot of post-op incision rechecks, I mean, those could be 5 minutes. So those kinds of things. So how much time is this going to take? Can somebody, especially if it's the client's first time to really do this, just help them verify that their technology works on their end? Just making sure you're in a quiet place. Recommend your client be in a quiet place, that there won't be a lot of distractions. If there's going to be questions about what medications are your pet taking, have all that stuff kind of ready. And then go, after that, it's a conversation, right? Just like we're having, except you may be showing your Fluffy, hey, look at Fluffy. Here's that with that.
Here's the
skin lesion
incision.
on the side,
Yeah.
right?
The skin
Here's
lesion.
all that. Or you may have photos that you sent ahead of time. And then how are you going to wrap up that visit? How are you going to get paid for the visit? Because it's still time, right?
Yeah.
If they came into the clinic for a recheck, you would get paid for that time. So what does that look like? Are you using a platform where the credit card's already in, and so the client's automatically charged? Is your CSR calling the client ahead of time and getting a credit card, or once you finish the appointment, collecting payment, whatever that looks like? So those kinds of things. And so I'm going to have a meeting with that new grad again next week.
So exciting. Well, you'll have to keep us
I can
posted
do that.
because it is interesting thinking about how technology is going to continue to transform.
Yes.
And I'm sure AI has been a topic that you guys have been hearing more and more about. I know
Yes.
I have. All
Yes.
the conferences I go to, there's more and more AI booths. So
All the time.
what are your thoughts on that? Like, how do you think it can improve veterinary medicine? What are things we should watch out for?
So I think some of the low-hanging fruit, like the AI scribes for medical record keeping.
Saved my life.
Yeah, exactly. Those are great. And we are using those at A&M now.
Amazing.
Yes. So the students can use them when they go in the exam rooms, the doctors, and we can share the patient so I can hear, what they've already recorded and what's been transcribed. So it's been transcribed. So we're doing that. I don't think AI is at the point where it's ready to make a diagnosis on my behalf. I've seen some crazy stuff.
Yeah.
When I've played around with
Absolutely.
it. I've seen it hallucinate medical references.
Oh, yeah, it's crazy. Like I
Yeah.
was working at ER shift. I was working overnights like 2 weeks ago, and I was treating a chronic kidney disease
Mhm.
cat. And then like the owner like pulls up a chat GPT of what he wants to do. And I was like, I really wouldn't do that. Like, let me tell you why. Yeah. Like I really wouldn't recommend, but
Right.
it is interesting
It is.
having like that level of access
It is.
to perceived medicine.
And hopefully we can, we already had clients using Dr. Google, right? They were doing their Google searches and coming in with their information. And so AI is like Dr. Google on steroids. So
Yes,
we have to remember that our clients are doing this because they really love their pets.
they do.
And they want to do the best for their pets. And
usually they're open to the conversation. Like when
Right.
I explained to him, like, hey, like this is actually what I prefer to do and this is why, he was like, oh, yeah, okay.
That makes more sense.
It makes more sense. So they're usually very open
They are.
to the conversation, which is so great.
And so it is a way for us to be more collaborative with our clients, to have those conversations. Like, that's an interesting idea, but fully to your point, this is the way that we prefer to approach it, and why.
And why?
And
Yeah,
so-
the why is so huge.
Yes.
And bringing them on your journey, right? Because they don't know the things that we know.
And they don't know our thought processes, and you don't know whichever AI chat that they used, where's it pulling its information from, right? We have access on some of these to things that are veterinary only that they don't have access to. And so that can help us as well. But I just see when clients do that, it's another way of fostering communication and
Yeah,
collaboration.
and I love that they're advocating for their pet,
Yes.
right?
Yes.
Like oftentimes when they're saying like, hey, I think the temperature changed, or
Right.
hey, I think the blood pressure going, this machine's beeping,
Yeah.
like it's great that they're advocating for their
Absolutely.
pet. We want their engagement and their involvement
Yes.
in our experience. Like it's their pet, they know them best. So the more we can collaborate with them,
Right.
like the better it is for all of us.
And they can
Everybody
see the
wins.
value in what we do.
Absolutely.
Yeah.
It's like a win-win.
Yeah.
So scribes, I've also heard of like maybe some AI scheduling tools that are
Yes,
coming online.
There are. So I'm the chief veterinary officer for Guardian Vets, which is started out as a teletriage company for after hours and stuff. And we've moved into taking overflow, so daytime overflow, helping the front office out. And one of the things that we have AI assist on is helping to schedule those appointments or refill request. So, it can help process those and save the people time to do the people touch, because we still need the human touch.
We
AI is
do.
not taking that
Yeah.
away.
Yeah.
So,
No,
yeah.
veterinarians are, and probably like medical professionals in general, our jobs are, people need us.
Yes,
And it's going to be a great thing. And hopefully AI can just give us a little bit more of that work-life balance that people are craving and a little bit more time.
Yes.
Okay.
Let me speak directly to the woman who feels like she's barely holding it all together. You are still competent. You are still high functioning. Your team probably thinks you're fine. Your family probably just thinks you're a little disconnected. But inside, you're exhausted, irritable, disconnected, and wondering if you chose the wrong path. Code Blue Coaching is not about quitting veterinary medicine. You've already invested $250,000 or more in your education, and there's also been time, energy, love, and compassion given to VetMed too. This is about reclaiming yourself inside of VetMed instead of giving up on it. Over 6 months, I partner with you and hold your hand as we identify patterns keeping you in survival mode. We rewire the perfectionism loop that constantly happens, rebuild your self-trust and your self-worth, create boundaries you can actually hold, and you have your accountability from yours truly. Don't forget, we also get a one-on-one personalized recovery protocol just for you that will help you for years beyond our coaching time together. So what you get is accountability, nervous system tools, and a true hand-holding pattern that will help you through with a white glove experience. And if you've been waiting for permission to choose yourself, now is the time. Make that extra moment to prioritize you so that way you can sustain your career in vet med. Now, if this calls to you or you're curious, go to evolvevets.com where you can learn more and book an alignment call with me so that way we can better discuss if this is the right next step for you. I hope to see you in there and that we can stop this code blue moment.
Anything else on the AI front or
I think we're good.
AVMA, anything like that?
With the organized veterinary medicine, please get engaged. If you're from Texas, join the Texas VMA. If you're not already a member, if you're in the US, join the AVMA and do that.
Exactly. No, I'm actually very curious because I think a theme of what our interview questions have been leading to is this theme of engagement.
Yes.
And I really want to understand what makes people engaged. Like, how do you keep that engagement? What do you say to people that have fallen off the engagement wagon? Like, how do you get them re-inspired? Because I see that in you being personally engaged, but then I also see that as a theme in your interview questions too.
Yes, it is. I think if you're engaged, you have a much greater appreciation for what we're doing. And so my son will tell you that my biggest pet peeve is whining. I don't do whining well. If you need to vent about something, I'm here for you, right? If you got to rant,
Rant it out.
right. I'm good with that. But if you're just going to whine, it's like nails on a chalkboard. It makes me crazy. And
not worth it.
No, it's not.
Let's seek some solutions here.
Exactly. And my son learned very quickly that I was not the parent to come whining to. I'm like, yeah, you go out, rethink that, come back, or go find your dad. But then my husband would come find me. Austin's like, I'm like, no. No, y'all.
You can figure that out.
Yeah, y'all figure that out.
I love and support you from here.
Right, exactly.
You're on this journey.
Yes, exactly. So this is where the problems get solutions, right, is in organized veterinary medicine. And if you're not engaged, you can't be part of that solution. And I would much rather people be part of the solution and not just on the sidelines complaining about it, or even just completely disengaged, because if you're complaining, you're at least still paying attention. Once you've just totally checked out, that's a lot harder. So I'd rather at least get you when you're whining, but don't whine for very long. Come be part of the solution.
Yeah, like we can help finding solutions.
Let's engage. I believe very much in meeting people where they are. So different people are in different places in their career, in their lives. And so how can I meet you where you are? And then how can we travel together to get to what you need? And if I'm not the one that can help you, because I can't help everybody, but I know people, and that's the great part about an organization like TVMA or AVMA, is if I can't help you, I probably know somebody that can, or I know somebody who knows somebody that can. And if it's a super big problem, we can come together to figure out how we're going to solve that. So that's one reason why TVMA is so great with its advocacy work. And some of its education and well-being work and supporting students and doing those kinds of things. Our incoming president is huge on mentorship and how can we expand our mentorship programs and help support not only students, but our recent grads. And that's true across your career, because you're not a recent grad forever. But once you become a mid-career person, there's different things that you need to consider. There's different parts of your life impacting you. And sometimes you need a little help seeing what that looks like. And as you start to get near the end of your career, what does that look like too? Whether I know some veterinarians who have retired, and now one of the big things they do is help mentor veterinarians who have retirement on the horizon. And so how do you prepare for that? So it's not just like, okay, my last day of work is December 31st and that's it. Goodbye. Right? Like,
Yeah.
You-
I've never thought about that, actually.
Yeah.
That's very
and I wouldn't have thought
intriguing.
about it till I can see it closer and closer.
Yes.
But I know veterinarians, and I'm not ready to retire. But I know veterinarians who have. And the ones that have retired successfully have also had a transition plan. So it's not just transitioning from school to practice. And then
It's transitioning from every phase almost.
all the way through. And so that's important. And so I think that's where mentorship, especially through an organization where you know people who can help be your mentor, can really do that. And that's much harder to do if you're out there in a silo.
Yeah. It sounds like you really believe in this dynamic of mentorship and coaching. Have you had coaches and mentors along your path that have really impacted you? And what was like your biggest takeaway?
A lot. Though I'm of the generation where it wasn't formally called mentorship or coaching. You know, a coach was your basketball coach. I played high school basketball, right? So that was my coach.
I love that.
But of course, I had so many informal mentors and coaches and people who were there for me. And it made a huge difference. It really made a difference when I got on the TVMA board of directors. It could be overwhelming, a lot coming at you at one time. And there were a couple of people on that board who started chatting with me. And it's like, well, this is what we do. And if you have questions about this, call me. And can I check in with you next week? And all those kinds of things. And made it very welcoming to be there. And one of my mentors, I'll throw out his name, it was Dr. Mark Cox. He lives in El Paso. Great human. And so he was a little bit ahead of me on the leadership journey through TVMA. And we then served on the executive committee together. And our joke... The perception was that we never agreed on anything. In reality, we really agreed on a lot of things. But if we disagreed on something, we were both passionate about whatever it was.
What side you were on?
Yes.
You were like, this is my side.
Yeah. But we were also very capable of having an adult conversation and open to hearing other perspectives. And so
Love that.
he did a lot to teach me that, and hopefully the same on the other side. And so I can remember very clearly sitting in an executive committee meeting, and we were trying to come to a decision on something. And Mark said, well, I think blah, blah, blah. I don't even remember what the topic was. And I said, well, I agree with Mark. I think blah, blah, blah. And like the room got quiet. And finally somebody said, there's no further discussion. Mark and Lori agree.
Like there would be about all in favor, you know?
And so, yeah, I mean, it was pretty funny. And Mark kind of looked at me and said, well, either we're both right or we're both wrong. But we're going on.
Oh, that's funny.
So, yeah.
Oh, I love it. Yeah. I really find that mentorship and coaching is just one of the best ways to transition through these different parts. Like some of the people that are in our community, they're struggling with like, you know, should I leave the profession? Like I'm feeling burnt out. I'm feeling overwhelmed. They're battling like these things of perfectionism and self-abandonment almost. Like I felt like I had to keep saying yes to like make everybody else happy, but then it's like, but you're not happy, honey. Like,
right.
Like, so I love.
You got to be happy first.
Yeah, you got to be happy, and I love that. Like as you're describing this concept of engagement, you said like I'm gonna go meet someone where they're at.
Yeah.
And then we're gonna come together on this path at their pace.
Yeah.
You know, with whatever they're willing to put in, because it is this slow transition from one phase to another, and people will go through jobs or I don't know, like we've had like cases that go to the board, you know, like there's these stressful things that you make a medical mistake, you lose a patient, you deal with an upset client. Like there's so many challenges that we experience, but like having that mentor or community that you actually show up and engage with, like, are you showing up too? Because it's not just always expecting someone to come meet you, right? There's this like meeting and then this path that you go on together.
And I'm not dragging somebody on that path. I mean, one, you have to want to go on the path, but if you want to go on that path, I will go with you. And as you said, at your pace.
What do you think is the thing that actually gets people to that point of wanting to be on the path?
I think everybody has different levels of motivation. And so some people are internally motivated, right? They're like, I've identified this is an area that I want to pursue. Other people, I think, get into a conversation and a light bulb just clicks on. And sometimes, and true for a lot of us in veterinary medicine, somebody asks you. I mean, you may have not even thought, I can do this, or I'm interested in this. And somebody comes and talks to you and they've seen something in you that you may not have seen in yourself. And so they ask you and you're like, oh, okay. Especially a good mentor or coach is like, and I will help you until you've got your feet under you and those kinds of things. So I think it's different for everybody. I think something else to keep in mind, since we talk about people who want to leave the profession and
Yeah,
what
let's
have
talk about
you,
it.
I think we have to step back and remember we're complex human beings. And sometimes things that affect us in our profession may not really be veterinary medicine itself. And so I can give you a couple of examples. I had breast cancer. I was diagnosed at the age of 31, so young, still early in my career. And that was like, oh my God, my son was 3.
Wow.
What
Like
am I
life
doing?
changer.
Right.
Yeah.
And so lots of self-reflection into that. Did I make the right choices? Do I want to be a veterinarian? Do I still want to be a veterinarian?
Yeah.
So took a couple of months off just to get through that and was able to like, yeah, I really do like being a veterinarian.
Yeah.
And so went back to practice. And then a few years later, our son was diagnosed with some pretty significant learning differences. And so what did that look like? And I actually ended up stepping back from veterinary medicine for 2 years. And I worked some Saturdays, a couple Saturdays a month, but that was it for 2 years because I needed to be there for my son as he navigated some pretty difficult challenges. But I will tell you that being a stay-at-home mom for the long term was not for me either. I was like, okay, we got over this hump, and I need to have more adult conversations, and I need to not. My brain needs the challenge. So when we got over that hump, I went back to practice. So I think it's also important to realize that we have lots of things that influence us. I love being a veterinarian. It is part of my identity. It's not my whole identity. And so those different things impact what we do and how we do it. And it's okay if you sometimes have to step back some. And sometimes y'all jump in both feet, right?
Yeah.
Totally in. So that's important as well. And another thing, the 7-year itch, right? I mean, they talk about that in relationships, but I think that impacts so much of what we do no matter what. And so you can be going along practicing 5, 6, 7, 8 years, and then you're like, really?
Yes.
Right?
Like
Same
another
thing.
diarrhea case.
I know.
Yeah.
I know. Like, oh my God, if I have to give the flea talk one more time or the dental talk one more time. And that's actually what made me decide to pursue ABVP certification. So I got boarded by them in canine and feline practice because, I mean, talk about a major, like you have to use your brain just to get through the process and write the papers and take the exam. But then you really have to stay on top of your game because you recertify. But it also really made me appreciate the more complex patients. I got lots of second opinions from that because people would be like, oh, maybe I'm not quite ready to go to the internist or whoever, but do you want just another look
Opinion.
at it?
Yeah.
So got a lot of those. So there are things you can do to still enjoy veterinary medicine. Probably another 7-year itch cycle later, I was like, well, what can I offer that not everybody around me is offering? And so I learned myofascial trigger point release. And so I could offer that to our clients, particularly those usually dogs. Cats aren't always as cooperative, but you can do it with cats. But helping with pain relief using trigger point therapy.
I
So
love that.
there's so much you can do in veterinary medicine. And so when people are thinking about leaving, I hope they find a mentor or find somebody they can trust to really help them. And I don't mean like a veterinarian as therapist, but just
Of course,
somebody
yeah.
that can help.
Yeah, like a life
help you
coach.
take a perspective,
Yeah.
kind of. And if you do need therapy, then by all means, please do that too, because
Yeah, both
There-
are
there
great.
are-
Yes, and. Yes, and.
there are definitely well-being issues and what have you to work through as well.
Absolutely. And I love that. I mean, this is what we talked about in our opening, right?
Mhm.
The diversity of veterinary medicine. And so it might look like you going into industry for a little bit. It might look like you taking a break to take care of your family. Like there are seasons. And at the Evolve Vets, we talk a lot about living in alignment with our authentic values.
Mhm.
So it means like for me, mine are adventure. So traveling, innovating, being,
Sure.
Travel bug.
Yes.
Community, which is like family,
Mhm.
and my love life. And like there are times where I had to say like, oh, I'm going to take a step back on my adventurous side and like pursuing work and running hard at work
Mhm.
so I can actually like start to date and find a partner because
There
I
you
want to
go.
get married and have kids. But like
There
if I
you
don't
go.
make time to date, like
Right.
that's never going to come to
Right.
life, right? So
You want
I
to meet
think
my son?
well, I actually have a boyfriend now, so
Okay,
it worked
fine.
out. But yeah, I would love to meet your son. But it's interesting because there are seasons where, to your point, it was a perfect example. Like there's seasons where you want to be both feet in on veterinary medicine, and that was like my last several seasons. And now I'm in a season where I'm really putting that community value first, and it's because like I want to invest in my family, my friends,
Sure.
my community, because I have run so hard at veterinary medicine, and there's a balance between all of them.
Absolutely.
And then there's seasons where you're gonna say like, others of my values are like luxury. So maybe I like want to spend a year like traveling the world
Yeah,
and then come back, right?
please
And
do
that's
it.
okay. Yeah, exactly.
Exactly.
Like who knows?
Right.
But being open-minded, having someone with you on that journey so you
Yes.
can process it. It's
Yes.
not just because I think as veterinarians sometimes, or probably all medical professionals that I know and have talked to, this doubt can come up.
Yes.
And tell you, no, you can't. Like, this is the only way. You have to just
Right.
give up, like, walk away. You're not built for this.
Nope.
But, like, I think when you get a mentor or a coach
Mhm.
or a therapist, or
Yeah.
all the above,
All of it.
you start to realize, like, there are so many options. And what if I just tried to mix it up a little bit,
Yeah.
like, getting your feline and canine certification? Like, that is something that furthered your career in veterinary medicine, brought your engagement, as we were talking about, and then also challenged you in a new
Totally.
way. That's the business that I'm building here is
Right.
all about a different, I'm at the 7-year mark,
Yeah.
right?
Yeah. Right.
So 7-year mark. And then I'm starting to say, okay, like I want to do something that's going to support the veterinarians in this
Sure.
field. How do we get them to stay? How do we have women feeling empowered and working through the things that are challenging in our field? So with that being said, what are some advice that you would give to female veterinarians or medical professionals? Because we do have some non-veterinarians that listen in too.
So we have technicians. My husband's a physician.
Exactly,
So
physician,
he's a
yes.
doctor. So I think the big thing is don't be scared. Be willing to try something new. We're major travelers. I hit all 7 continents 2 years ago. So
That's
was
so
that-
exciting.
know,
I want to hear all about that.
Okay, I was so happy. But back on to what you're saying. Always be curious. So every opportunity is the opportunity to learn something new. So sitting here with you, learning new things about you. But every opportunity, and curiosity is one of my values. Like, what can I learn? What can I take away from this? Sometimes it may be something small. Sometimes it may be like, oh my God, how did I never think of that? That's amazing. Be curious. Be willing to say yes, and also be willing to say no. So understanding that about yourself, don't just be an automatic no, I can't do that. But be selective with your yeses and how many things can you say yes to, because then they open up other opportunities. So if I had not said yes to TVMA as a volunteer to serve on the board, I would not have met people who then provided me the opportunity to go teach at Texas A&M.
Right.
Yes. And if I had not said yes to some opportunities to work at the AVMA, I would not have had the opportunity to testify before Congress. And so those were amazing things. And some of my travels are because I said yes to some of those things. And you never know what doors are going to open. And of course, every time you open a door, another one may close. But 10 more could be on the other side of that one that you opened.
That's
And
so true.
it is some of it's appreciating the unknown, right? Okay, I'm willing to try this. Some of it's also being comfortable with the unknown. Veterinary medicine is not black and white as much as we'd like it to be black and white, as much as our clients would like it to be black and white. But there's a lot of gray and unknown, and learning to be comfortable with that, and not just in veterinary medicine, but in life itself. And like, yeah, I'm going to do that. I'm going to go to that show. I'm going to join that club. I'm going to volunteer for that organization. I'm going to challenge myself with that procedure, because what I get on the other side of that is usually pretty amazing.
I love that. Follow-up question. How do you know when it's a yes versus a no?
It's a really good question. And I think some of it's just life experience, right? I've said enough yeses and nos to have a better appreciation of when I should and when I should not. And so some of that may be that at some point in our life, we've said yes too many times, and then those balls start falling. But then you have to be willing to own that too. You have to be accountable. And that may be going to probably not your boss. It's probably a different ball that's falling. But whatever group you may be volunteering for, saying, I really need to step back. I said yes to that and I shouldn't. So you have to be willing to own it.
Yeah.
But the other side of that is you said no to so many things that you're like in this major rut. And like, I'm not learning anything new. I think that's when we start to get maybe a little bored, maybe
Isolated.
a little anxious, isolated. What am I missing? And you can spiral if you don't recognize that and say, okay, I need to start saying yes to some things, and I need to be willing to put my foot out there and take a chance.
If you love this podcast, you find yourself nodding along, thinking, this is exactly how I feel at work, and sometimes even outside of work, then I want to invite you to something even bigger. Come with me to the Evolve Vets membership. It's my online home and community for women in veterinary medicine who are done surviving and ready to start evolving. Inside the membership, you're going to find race-approved masterclasses, vet reset meditations, live monthly coaching with yours truly, and a community of women who actually get it. It's not toxic positivity. It's not just another membership you sign up for. It's learning how to manage your energy, protect your boundaries, and build a sustainable career in veterinary medicine. It's your choice to move from self-abandonment to self-devotion. And the truth is, you don't have to do it alone, my friend. Come evolve with us.
With my clients, I usually say it's a good idea to kind of take a step back and just feel in your body. Because if you find yourself being resentful about saying yes to something, it probably means it's like next time you should say no.
No. Yeah, that's a great
And notice
great
it
point.
in your body, and you'll start to recognize when you want to say no.
Yeah.
Because a lot of us tend to be people pleasers in medicine, right? We're healers. We want to focus on rescuing and saving people and pets. And sometimes we get so enveloped in that expectation, or what we perceive as an expectation, that sometimes we fall into this people-pleasing pattern. And unfortunately, we kind of wall off our own intuition and wall off our own body and how we feel in it. So when we start to just pay attention, so the next time you're faced with a yes or no question, our challenge to you is, how does it feel in your body when you think about the yes? And then how does it feel in your body when you think about the no?
Right.
And just notice it. It doesn't mean you have to change your answer the first time, but notice how it feels. And then maybe the next time you feel a little bit more confident in making that decision.
And it's okay to pause, right? If they ask you, you can always say, I need to think about that.
Yeah.
Right back to you, right? You don't have to immediately say yes or no. And so what do you feel in your body when you take that pause?
Exactly.
And if it's just like, that's going to keep me awake at night, every night for the next 6 months or whatever,
probably not worth it.
That's a no. That's a no. But if you're like, wow, that could be really cool or fun, then that one's going to be a yes.
Then you should do it.
Yes.
Exactly.
Yeah.
And I think, okay, so the thing that you said was, my authentic value is curiosity. Do you have others that stand out to you?
Yes. Integrity, accountability, loyalty. My husband and I are high school sweethearts.
Oh, I love that.
Yeah.
Oh, that's so adorable.
And of course, loyalty. I mean, we love each other, but
You're loyal.
you have a long relationship. there's ups and downs with that. So loyalty is huge because
Well-
we're going to get through that together, whatever it is. So that would be a biggie. Honesty, transparency. I mean, I hate that those sounds so trite, but I try to live by those.
It matters.
Standing up for people. That's like, if I'm the leader of a team, I want to be able to elevate the whole team. But if there's an issue, then I'm going to go to bat for them and do that too.
I love that. And many people have challenges when it comes to being a woman in medicine and like being a mom and juggling the leadership roles and the volunteer, the engagement, all of the things. Do you have any advice for our listeners on that front?
Major support system. I mean, you can't do any one of those things alone, but you certainly can't do all of them alone. My husband is my number one cheerleader and supporter, and yes, he's a physician. He has a full-time job. His hours are insane, but he was always there supporting me, and whatever we needed to make work, we worked. And so there were plenty of nights I was home doing childcare and stuff while he did what he needed to do. If I needed to leave town to go to a meeting, we made the childcare work. So having a support system for that, having the mentors to help you work through challenging cases, finding friends at school. So if you can't go pick up your child, I mean, getting the carpool together, whatever that looks like, doing those kinds of things. And sometimes that's part of learning the yeses and nos. So you may be saying no over here. Like, I am not going to chair the book sale at school, right? The PTO book sale.
Yes.
I will come and work a couple of shifts at the book sale so that you can say yes over here. And sometimes it may be, no, I cannot help find speakers for that conference because I need to help the science fair at school.
Right.
And so there were times that I did that.
It's
And
the balance of
it is the
everything. It's really
balance.
the energy management because when you say yes to
Yes.
one thing, you're going to say no to the other.
Yep.
And sometimes it's a blend because sometimes you might say yes to the work bucket. Sometimes you might be saying yes to the you bucket or your relationship or
Right.
your kids, like all the different buckets.
Yes.
And it's like being able to say yes and then yes and then yes and then yes. And then for those of you who are listening, I'm just pointing around an imaginary clock or circle to all the individual buckets because it is the balance isn't doing one or the other. It's like finding a way to do them all in a way that serves each department in a balanced way that makes your soul feel excited.
Yes.
Amazing.
I mean, one of my things is I wanted to be the field trip chaperone when my son was little.
That's so cute.
Right. I didn't need to do the book sale or the other things, but I really, really loved chaperoning field trips. And so if they weren't on my day off, I'd find somebody at work to trade with.
I love that.
Right. And that was fine. If they needed to be off for something, then okay, that's fine. We'll trade and I'll see you go do your thing. So that was really, just finding
It's the
finding
thing that
people will
matters
work
to
with
you, right? I have a client that I was coaching, and she was starting to feel frustrated with veterinary medicine, and she came to me and was like, "Should I just quit?" And I was like, "Hold on, let's figure out what's going on here." And we went through this journey of understanding, like, okay, well, why are you starting to feel resentful? Okay, well, you're feeling resentful because you feel like when you're home, you're not spending time with your, young daughter.
Right.
Okay, let's dive in. Why? Okay, well, people are calling you during rounds or their time where they're busy at the hospital, but you're missing bedtime.
Right.
So like, how can we take that 6 p.m. to 8 p.m. block and don't answer your phone? And you tell them, I'm not going to answer my phone between 6 and 8 p.m. And guess what? Like, super fulfilled, finding compassion, like loves the job. It was just like, we need some boundaries to love our kids and love our family and love our job, because when we start sacrificing and giving more and more of that away, that's where the resentment builds and the apathy, and that leads to compassion fatigue and burnout, right? That's the journey.
Absolutely.
So just like those moments of boundaries ends up what's being super important. So tell me, you said one of your passions is traveling.
Yes.
So in that you hit all 7 continents. I want to hear everything about this because as an avid traveler, I need to know the details.
So I'm a veterinarian, my husband's a physician, and we figured out fairly early on that the only way to really have time to ourselves or family or friend, whatever that is that was not work, was to travel, right? Because even if
So that's your like all in, all out approach.
yes. Though, here's what's really funny. So we were on safari in Africa, the middle of nowhere, no cell phone reception, nothing. I mean, if you needed to call out, you had to go ask the camp director for the satellite
Like you
phone.
were trapped.
We're
Trapped and isolated. You needed that.
It
though.
was the best. And there were 7 of us, and I think the camp held 12. So there were 5 other people. One of those people was one of my husband's patients.
No
I was
way.
like, you've got to be kidding me.
How does that even happen?
I don't know. We came halfway around the world to escape our lives. And I mean, she was great. She was
Oh,
super
of course.
nice.
Yeah.
But it was just like, really?
So how did we see you here?
No. So, I mean, we started traveling super, super early in our marriage because it was just the way to get away. And I mean, we didn't have a whole lot of money then. I mean, it literally may have been a long weekend in San Antonio or Galveston or whatever. But as we got more comfortable and more successful in our careers, went to Europe and traveled lots of Europe. We love food. My husband's hobby is wine. So he actually has a sommelier certification just as a hobby. So
I love that. I can't wait to go to a winery with you guys. That
my
sounds
God.
incredible.
I mean, and that's what a lot of our trips are. But we've, of course, done California and Oregon and Washington and some of the wine regions in the U.S. But we've done Italy and France and Austria and some of those European things. And then we're like, okay, well, where else should we go? And Africa had always been
on the list.
top.
Wow.
So when I had been diagnosed with breast cancer, I said, okay, and my husband was still a resident or just finished his residency at that time. So like, okay, don't have money now, but you're taking me to Africa before I'm 40. So when I turned 39, we went to Africa. I mean, mind-blowing experience.
Yeah.
We've been back since, still mind-blowing. Then, of course, Australia and New Zealand were also bucket list items. So we scheduled the time to go there. And when you go, because I know you will, if you have not already been, those need to be separate trips.
Okay.
Don't try to combine them.
Don't do it.
New Zealand is much bigger than people think, and it's 2 different islands that make it, and you really need your full time there. And Australia is obviously huge; it's a continent, and so you really need your full time there too. And we've been to Australia twice, and we've done the Galapagos because after safari, it's like, okay, I got to go to the Galapagos.
Yes.
So that was our first foray into South America, and then we've done Machu Picchu and some of the stuff in South America. And then we really was like, we should go to Japan. Let's go to Japan.
Yes.
So for our 30th wedding anniversary, we went to Japan. And again, amazing.
Incredible.
Yeah. And a couple years ago, we're like, okay, the only continent we haven't been to is Antarctica. And I mean, penguins.
Why else?
Right.
Like, enough said.
How can you not go to Antarctica? So that was our 7th continent.
Wow.
And it was the best.
Did y'all do a cruise?
Yeah, that's really
the only way, right?
Yeah. Unless you're on a research base. I think there's one place you may be able to stay for like 1 week of the year or something, but it was a cruise.
Yeah. My friends that have gone said the cruise is the way to go.
It's
really.
definitely the way to go.
So exciting. I love hearing about all your adventurous stories. Is there any one trip that really stands out? Or when people ask me that question, I can't answer it.
They're all special for their own different reasons. Like we went to Italy 3 weeks after 9/11. Wow. And of course, the whole thing, you can't travel to Europe right now, right? I mean, the world's going to blow up. And actually, we're like, we're gonna go. My in-laws were taking care of our son, their grandson. And they were like, just make sure you have a cell phone and ways for us to communicate. And we said yes. And they had like our itinerary down to the minute. So that for that. And of course, the day before we leave, the State Department releases high terrorism alert. Do not travel to Italy. Because I'm sure they were hearing all sorts of chatter. And we're like, we're still going to go.
Yeah, I think this could be fun.
And it was great. I mean, not the 9/11 part, but there were no tourists because everybody, so not great for Italy, but great for us.
Right.
There were no lines, no
You had a more genuine experience.
Yes.
Too.
And the Italians were so appreciative of us coming and feeling safe enough to be there. And I can remember eating at a major fancy restaurant one night, and it was us. There was nobody else in the restaurant. And we're like, well, what do you have for dessert? And my husband, and we were with another couple at this point that we had met on the trip. And they're like, well, we have this and this. And my son's like, well, do you have any chocolate or any caramel? And then my friend was like, and what blah, blah, blah. And the waiter just looked at him and said, come into the kitchen. I'll introduce you to the chef,
so
and y'all can just create your own dessert.
Oh, wow, what a magical experience.
It was great. And because we were, of course, they weren't having to see a whole restaurant of people. And so those kinds of things. So, that made that trip special.
That's incredible.
Yeah. I mean, every trip has its own things that stand out.
I had a moment similar to y'all's Africa trip. For my 33rd birthday, I took a flight to Bora Bora.
Ooh.
So for me, I've always dreamed about going to Bora Bora. It's always been top on my list. I want to live by the ocean one day, live in a beach bungalow. And so this has been really high priority with, the overwater bungalow experience and the snorkeling.
How was it?
It was incredible. And I have always told myself I needed to wait to go because that's something you should save for your honeymoon.
No, don't wait.
And then literally 4 days before my birthday, I was like, I have the time off.
Yep.
I'm going. I was like, let's book it, you know, and that spontaneity is definitely in my adventure authentic value. And I went, and when I got there, the Turners, Dr. Turners from the class above me were there, and we got to hang out the whole time. So I actually didn't have to hang out alone the entire 10 days of my trip. I actually got to meet and hang out with some of my friends from vet school.
That is so funny.
But just those small moments where you're like, okay, I was supposed to be here.
Right.
I was supposed to do this. This is part of the journey.
And I'm so glad you didn't wait.
I'm so glad I didn't wait. It was a journey of self-love and self-worth, right? Saying, okay, I deserve to go today, and I love myself enough to go today. And if I want to go there for my honeymoon and I have a good time, I can go there. Right? I can have a very beautiful and fun experience. I don't have to save it.
Right.
I'm not in lack without that part of my life. I can be whole on my own. And then, funny enough, my boyfriend and I actually matched on Hinge when I was on that trip.
Oh, that's too funny.
So we started talking while I was there. I was like, oh, okay. So the universe was like, do you believe that you're worthy? Okay. Because once you do, here, you get the little present, which is really fun. Travel is just so adventurous and makes my soul light up. And it sounds like for you guys, it's a very sacred practice that brings you guys back together.
Experiences, totally.
Yeah, I absolutely agree.
Without all the distractions.
Without the distractions, it's the best part.
It is.
So Lori, thank you so much for coming on the podcast
Thanks
today.
for having me. It's been wonderful.
Oh, I've had the best time.
Yeah.
And just for all of our listeners, I need to point out that Lori has the absolutely insane most best glasses, and every time I see her she's wearing a different color, and it just shows your vibrance, and I think you really brought that to the podcast today. I love all your insights, and I'm so excited for your next chapter. So congratulations again on your new position.
I appreciate it. Thanks so much for having me. It's been wonderful.
Oh, thank you. Okay, so today let's stop revolving and start evolving. Thanks, guys. Bye. Thank you so much for listening to the Evolve Vets podcast. It truly means the world to me. If this episode supported you or sparked something new in you, please go to evolvevets.com to become a member or join our coaching program and truly continue this work beyond the podcast. Let's evolve together.